Welcome to Caraconference 2023, brought to you by Caracol, Greater Cincinnati's AIDS service organization devoted to positively changing lives in the fight against HIV/AIDS. My name is Midge Hines, and I'm the Chief Program Officer at Caracol. And for today's session, we will have a panel discussion about the intersection of harm reduction and intimate partner violence, which will be moderated by Caracol's Jamie Brogan. So Jamie, I think you're up.
Awesome. Thank you, Midge. My name is Jamie. I've been with Caracol for going on 5 years now. It'll be 5 years after the beginning of the year. I now work on our Poppy team as a PrEP navigator. And before that, when I first came to Caracol, I worked on the harm reduction team for about 4 years. So very excited to be leading this panel today, and I'm excited to hear from all these women and what they have to say and share their experience. And I will let them go ahead and introduce themselves. Amanda Lynn, do you want to go first?
Sure. Howdy, everybody. My name is Amanda Lynn Reese. You can call me Amanda or Mandy. I always say anything but late for dinner. I am the Chief Program Officer, formerly the Director of Programming at Harm Reduction Ohio. I'm a person with living experience of both intimate partner violence and as a person who uses drugs. I have been in harm reduction for about 11 years, and my position at Harm Reduction Ohio going on 4 years. Thank you very much.
Thank you, Amanda Lynn. Either one of you who wants to jump in now, go ahead.
Hi, good morning. My name is Juana Medeiros. I am the Systems Training Program Manager with Women Helping Women. I started with Women Helping Women probably about 3 years ago as a divert advocate part-time, and recently joined full-time in October. Myself, I also have experience with intimate partner violence. And so I'm happy to be here and share my experience and knowledge about intimate partner violence and harm reduction.
Thank you so much, Joanne. Wendy?
Thank you. My name is Wendy Waters-Cannell, and my pronouns are she, her, and hers. I am the CEO of YWCA Hamilton, located in Butler County. Our mission, as you can see by my slide, is eliminating racism and empowering women. And primarily, we have 3 programs, the first of which is racial justice. But the one we're most known for here in Butler County is probably the domestic violence program. We are the only shelter in the entire county dedicated to intimate partner violence and domestic violence. With that said, we also take survivors of human trafficking, and we also take survivors of sexual assault if needed. I am honored to be here today with my esteemed colleagues on this panel, and we hope that we can provide you useful information that will help you in the field of harm reduction.
Thank you, Wendy. All right, we'll go ahead and jump into the questions now. And as Midge said before, any of our attendees, if you have additional questions for our panelists, feel free to put them in the Q&A feature, and Midge will jump in and ask those as time allows. So our first question is, and just jump in as whoever wants to speak first. In your own words, what is the correlation between intimate partner violence and harm reduction? What are some harm reduction strategies you use in your work?
I'll go ahead and go first. For me, the intersection of harm reduction and intimate partner violence is pretty large. Intersections become kind of a buzzword in the last few years. And where I see the true overlap being that 20% of people who use drugs worldwide are women. And we believe that's underreported, but that's our limited data shows that. And we know that this puts them at increased risk for intimate partner violence. And harm reduction is really a movement, a set of principles about reducing the consequences for high risk behavior. And so the truth is, risk is measurable. And what we need to do is give tools and education to folks who are victims, and those who support them, so that they can, lower that risk and manage it. And that's really our job in harm reduction, is to give autonomy to the folks who are living their own lives as the experts of their own lives, and then give them as much education, resources, and tools to make measurable risk adjustments on a daily basis. I also think the one intersection I would speak to that is important to my work right now is that folks who are victims of intimate partner violence sometimes sustain head injury. And if someone is going to use drugs, they also are at risk of hypoxia, which is a lack of oxygen to the brain, as if they suffer overdose. And so if you're losing oxygen to the brain from a head injury, from overdose, and that is a repeat occurrence, it has long-term cognitive effects on an individual and their ability to manage risk and many other things. And it just compounds the issues that they face. And so that's really something that's at the forefront of my practice right now. Thank you.
All right. Thank you, Amanda. It's kind of hard to go behind that. And so I come from a chemical dependency background. And so also when I think about harm reduction and intimate partner violence, I look at it at a standpoint from the chemical dependency program that I've come from. And like she said, reducing the harm that comes with risky behaviors. And so when we put that with intimate partner violence, I look at it more of the survivor doing what they need to do to reduce their harm in that relationship. A lot of people always say, well, why you just don't leave? Why you don't do this or why you don't do that? Not knowing the situation that the survivor is in. And so a lot of times survivors do what they need to do to survive in that relationship, whether that is leaving, whether that is, staying and dealing with what's going on and just making it easier for them to live in that situation until they are able to escape that situation. And so when I look at harm reduction, I look at it more of the survivor doing what they need to do to make it safe for them at that particular moment or during that time when they're dealing with the situation or the person or the abuser.
Thank you. For us at YWCA Hamilton and in the domestic violence shelter, harm reduction looks like a couple of things, not the least of which is, of course, just escaping immediate lethality situations. But we work very hard to be one of the lowest barrier DV shelters in the area. So we do not screen out folks who have mental health issues or those who are actively using. So the minute a survivor arrives with or without dependents and or their pets, we are assessing for what those areas of concern may be and helping them understand what harm reduction looks like in our environment. We do not say, simply because you're here, if you start to use, you're kicked out. We look at what can we do to help you use safely here instead of returning to an unsafe condition that also includes violence. We may also begin to look at education around if it's a person that can become pregnant, what birth control may look like within their scope of control, because we know that perpetrators often use threats of abuse against children and or pregnancy and or drugs and alcohol to help trap and keep a survivor where they want them. And so we're assessing for all of those risks. I appreciate the mention of the strangulation and head trauma, because we know that sometimes head trauma survivors present very differently, and it can be confused for drug use or mental health, and it could be any and all of that. So we're using our skills to the best of our ability to assess what the greatest risks are at the moment and getting referrals for treatment and support as that survivor would like to have happen. We don't make any assumptions that it is an immediate referral for treatment. That is not for us to say. We are here to walk alongside that survivor and their family members, not direct the treatment.
Thank you all. Those were certainly some very good answers. That leads us into our next question, which is kind of goes really well with how you all answered, and that is why do victims or why do survivors sometimes return to their abusers?
I will let the ladies who work on this every day answer this more robustly, but I will share anecdotally with the people I serve, talk about and what it was like for me. For me, it meant consistent housing. For me, it meant what was familiar. And I don't know what everyone knows about their somatic nervous system, but sometimes making a change is so much harder on the body, even if it's a good change that is going to make life healthier and happier. It is so difficult for our nervous systems to allow that to happen because we're in survival mode. And we know it, we have some sense of what we believe is control over our experience if we stay in what's familiar. I also believed that this person had the capacity to do well, to do better, and that we would make change incrementally together. And I think that that's a lot of what people believe. Also, in my work, especially I'm working with folks who are in active use, sometimes there is some control. Say I have a chemical dependency, I have a dependency on opioids, I have a dependency on alcohol, any of those things, and my partner controls my access to those things. Then I am looking at them as my medication, as my literal way to survive and live without going through very difficult withdrawal. There are people when I work with needle exchange or syringe programs where they'll restrict access to dirty syringes, used syringes, so that I can't trade them in and get new ones. That's why needs-based programs are so important and one-for-one exchanges are so harmful, because I might not have access to what I need so that I can use safely and prevent HIV and Hep C and those sorts of things. And I also know that in many relationships, that's a part of their intimacy is using together. Some people can't use intravenously on their own, but their partner will do it for them. They often teach them how to do it. They often get them in situations where they're just controlling all parts of life, and that makes it so difficult, you know. I think it's really important that we remember, again, with that cognitive potential dysfunction, our ability to make good decisions can truly change. And we're expected to be at group for this many minutes, we're expected to be at this place for this many minutes, and just remembering where my keys are might be very difficult when I'm suffering from this kind of cognitive dysfunction.
Yes, that was a great answer, Amanda. Um, that's one of the most frustrating things that people deal with is why they go back. But it's also one of the realest things that people who are supporting survivors also have to realize is that there's a reason that people go back. And it might be different reasons. Amanda talked about housing. You know, if I live with the abuser and this is my only home, where am I going to go if I leave this relationship? If the abuser is the one that's taking care of me and my family and I'm not the bread maker, how am I going to support me and my family? And so there's a lot of different reasons that survivors stay in these relationships. It comes back to surviving the situation. And so when you asking why do you stay, that's a question that shouldn't be asked, because everybody has their own reasons to why they stay, and nobody can say that they're wrong, because again, we have to base it on what the survivor needs, what the survivor says their needs are. And so therefore that's what we have to look at. And being able to eat, being able to be taken care of, being able to have medical access, you know, a lot of things that abusers control, because we come back to intimate partner violence is about control, having control over the other person. And so a lot of times abusers have all this control where the survivor doesn't have the autonomy to make a lot of decisions. The abuser makes the decisions. And so therefore, if I can't survive without this abuser, or I don't think I can survive without this abuser, I'm going to continue to go back because this is the way of my life. This is how I know how to live, how to survive.
Thank you both for your honest sharing. I would say that for us in the domestic violence shelter, and many of you may know that we just opened the brand new shelter here in Butler County, and it nearly tripled the size of the number of survivors and their dependents that we can serve. We have also seen a tripling of the calls to our crisis hotline during the pandemic, and it's done nothing but increase. So a couple of things I want to say as a clinician, and that is that we yet don't understand the long-term impacts of the pandemic on our society as it relates to financial harm and just trauma. So I want to emphasize trauma specifically as it relates to the scientific knowledge we have around the development of brains of individuals who have experienced long-term trauma, especially that trauma that happens before the age of 18. From our experience here, there is some correlation between folks who end up in abusive situations who have already had trauma and abuse in their lives early on. And so we know that that part of the brain is not the part that's lit up and functioning. And so saying to someone, why don't you just leave, is literally like blaming someone who has no knowledge or awareness that what they're doing is harmful. And I'm not making any excuses for that. What I'm saying is we as providers of support have to appreciate the trauma brain and how to engage with survivors in a way that gives them voice and control and a sense of dignity and humility from us as advocates for what they have survived to get to this point. Lastly, I would say those who end up in shelter are generally the ones who are most vulnerable, because no one wants to go to a shelter and live with a bunch of strangers. If you can stay in your home in any way possible, you will. And so oftentimes the calls to our hotline, and I know Women Helping Women does this as well, is to help the survivor safely, to reduce the risks of harm immediately, and to plan for a safe escape where they have all of the resources they need in order to make a transition. My plug is also that we need more shelters at this point, but we should also be focusing as a society about why this violence continues and getting to the root cause of it so that we go out of business, because intimate partner violence and domestic violence has been eradicated.
Thank you,
Can I
Wendy. Sorry.
I'm sorry. I'm sorry.
You-
I
you go
was trying to say one more thing. Another thing about leaving, people don't realize is that leaving can be the most dangerous part or dangerous time for a person that's dealing with intimate partner violence. It gets more dangerous when you are trying to leave or when you are trying to take up for yourself. And so a lot of times that's another reason people do stay, because they know that if this person has told me they're going to kill me if I do this, if I do that, they know to believe them. And so if you don't have a safe place to go or have that support system that usually disappears when you're in that intimate partner violence because of the control and the isolation that the abuser has put upon you, it's hard to leave that situation. And so I just want everybody to understand it's not easy to leave, not as much as people think it is. That's one of the most dangerous times for anybody that's dealing with intimate partner violence.
That's exactly that's the perfect segue to what I was going to say. I was going to say the escalation, the increased risk as you're trying to exit the situation really does happen. And I think that Wendy spoke to something beautiful, and Women Helping Women is great for this too, that they don't put up barriers for people in active use or with other, people don't barrier out, as we say in the field sometimes, when somebody has extreme need, mental health wise or other disabilities that they might have. Lots of times our facilities, which are nonprofits and usually community run and usually on the backs of volunteers, usually faith-based, can really have a lot of stigma and just lack of resources for folks seeking help. And so again, as a community, like Wendy said, we really need to rally around our idea of who's worthy of help. And remember that folks show up as they are, and showing up is amazing. And that your best looks different every day. And that person has done their best just surviving that day.
Yes, I like that. Also, I meant to put out there also with Women Helping Women, we work with all survivors, not, no matter when it happened, whether you reported it to the police or not, family members also, because they're surviving as well. If they are witnessing that or they're a part of that family and they're dealing with it, they are also survivors. So we don't have a cutoff for when a person wants to get help. It may have happened 20 years ago, but if you decide today is the day that I want to reach out and get some help, Women Helping Women, we will help you, men, women, no matter who you are, because intimate partner violence affects more than just women. I'm glad that we're starting to look at that now, that it is not just a woman thing. It's a everybody thing. It's a us thing. And so therefore, we're not limiting who we help. We help anybody that identifies as a survivor.
Thank you all so much. Those were great answers. And too often in these situations, situations like this are used to discredit the stories of survivors and, victim blame. And it's really important that this education is out there. Our next question is, can you talk about the difficulties of working with people experiencing IPV who do not want to take action? And what can you share some advice to professionals in the field to help individuals in this situation?
Yes, I can go off of that. Myself, I've never experienced frustration with survivors. I know that other people have. And I don't think it's frustration. I think it's more about being triggered. A lot of times in this field, a lot of us have had experience of being intimate partner, having that DV and intimate partner violence happen towards us. And so when you see a survivor continuously going back, and if you don't have the understanding of what they're going through, it's easy to become frustrated. But again, we have to look at it like the survivor is doing what they need to do to live and survive. And so what I would tell professionals is we can't take it personal. We are here to help. We need to listen to what they feel or think or know is what they need. It's not about us. It's about them. And if we are being triggered, we got to do self-care for ourselves. We got to make sure that we are taking care of ourselves, because we can't help nobody else if we're not taking care of ourselves. And working in this field can be very traumatic for a lot of us. Even just hearing the stories when you're talking to survivors can be traumatic for the professional themselves. So being able to take care of yourself mentally, being able to not distance yourself, but not take it personal. You can only help so much. I think sometimes we jump into the field, we want to save the world, we want to be super women, and we want to make sure that everybody is good. And when things don't happen the way we think it should happen, that's what makes it frustrating. And so we have to step out of that, we all want to see survivors get help. We all want to see survivors do good, but we also have to realize that the survivor knows what they need. And it's not up to us. We have to support them, and we are helping them so that they can make the best decisions for themselves. What we can do is educate them, let them know what their risks are, give them the resources, and then be there to support them when they need our support, when they're asking for our support, instead of victim blaming or asking why.
I was just going to say, I think you summed it up pretty well. I would just say the autonomy is really important of our folks. They're still people, and their autonomy has been taken away in many other instances by this control, this grooming, and this abuse. And empowering folks, no matter what their choice is really, really important. And staying there through them. In harm reduction, people say meet people where they're at. At HRO, we take it a step further and we say don't leave them there. That doesn't necessarily mean drag them out of where they're at or convince them to make a change. What it means is keep meeting them where they're at, keep showing up. And something that's really important is that secondary trauma is real. Hearing that stuff is heavy, it's real. And I get very frustrated when I hear the words compassion fatigue. And I get frustrated when I hear that the word self-care. Not because those aren't valid, real things, but no amount of spa days is going to make me prepared to hear about what happens to some of these folks. I have an 8 on the ACEs score. If you don't know what that is, look it up and take it. It makes it very difficult to have a typical experience in our culture when you have that kind of trauma background, like Wendy said. And I think that we really need to remember that these folks, again, do their best every day, and that might look different every day.
I think the only thing that I would add to this conversation, and many of you are not going to be surprised by this as a YWCA representative, is that we are really talking about triggers of judgment and implicit bias. And so we must be examining that as caregivers, as advocates for those who are experiencing intimate partner violence, as well as what are the triggers from our own trauma. Because let's be honest, those of us who are drawn to this work are usually survivors ourselves. And so if we're not self-aware of what we're hearing and seeing from our survivors. It can trigger defense mechanisms in our own posture, our vocal tone, and our choices of wording that could literally further harm and shut down a survivor who might just be ready to make that next step. So my urge to the entire community is to make sure that you're doing the work to understand what your implicit biases might be so that you can be aware of how they might be manifested during your interactions with survivors. I think the last thing that I would say is it can be a tremendous strength to be vulnerable with survivors and to share appropriately within normal boundaries that you see them because maybe you've survived it yourself. But that vulnerability makes you mushy, for lack of a better term. By the end of the day, you're just emotionally, psychologically, spiritually exhausted. And I agree. No amount of spa days are going to take care of that mushiness. But therapy, professional coaching, connection with your peers so that you have a sense of community where you can just let it be and rejuvenate are really our survival strategies. Just like our survivors, knowing you are not alone, knowing that you are not facing this vicarious trauma, and the effort to try and help survivors move to a place of safety can be a very frustrating experience day after day. So tap your support community, because when you are not alone, you have much more energy to face it the very next morning when the alarm clock goes.
Jamie, we do have a question in the chat. And the question is there a reason why you've never changed the name of Women Helping Women since you also help men? It's hard when a male client calls us for help and we have to explain that it's not just for women, to help encourage them to call and utilize a program that has a title that it's for women.
Yes, I hear that a lot, especially from men when I'm out in the field. Like, what happened to men helping men? And I have to explain to them that we help everyone. But Women Helping Women is in the process of trying to find new names. They're doing a whole new strategic planning where there's a lot of things that's going to change with Women Helping Women. People have to realize that Women Helping Women came back in the 70s, 73, I believe, is when Women Helping Women was formed. And at that time, that's what we all knew is it was about women being abused at that time. And over the years, things have changed where now we know it's not just women that's being abused. So Women Helping Women is in the process of, working to change a lot of things so that people do know that we don't just help women, that we help everyone. Just be patient with us. We are working on that name.
Thank you.
Mandolin.
Implicit bias again.
Exactly. And I can jump in there real quickly with YWCA. Historically, YWCA stood for Young Women's Christian Association. So talk about exclusionary language. We are switching to YWCA only. They're just letters because we serve everyone. We are particularly in the space and very intentionally in the LGBTQIA++ here in Butler County because there needs to be a safe place for survivors to go. But we are allies and activists with them. In addition to serving men, in my tenure here, which is 5.5 years, we have had several single fathers show up with their children. It's not an everyday occurrence, but we recognize it is an occurrence. We serve everyone.
Thank you. To bounce off of what you said before, Wendy, our next question has to do with how we, as professionals, have those interactions with survivors when we're trying to assist them. And so in order to maintain that trusting or build and maintain that trusting relationship, are there any questions or that you want to avoid asking or subjects that you want to avoid speaking on or asking about when you're speaking with a person?
I'm sorry.
No, that's a great question. Go ahead.
Okay. When I'm working with survivors, one thing I don't do is ask them to repeat the story. Because it's re-traumatizing them, and they are being asked to tell that story over and over and over and over again. And so I tell them, if you want to tell me the story, you can tell me the story, but you don't have to tell me anything that's going on. I am here to help you. A question that I would not ask them is, what did you do? Why did it happen? Why are you still there? Anything that makes them feel like we're blaming them for the situation, because you don't want survivors to start feeling like they already have people, their family and friends that are taking them through that. Why you waiting? Why you doing this? Why this? Why that? Why you ain't leave? And it's like, okay, you blaming me for what's going on in this relationship when I'm not the one at fault. And so one thing you don't want to keep asking is that why. Don't make them repeat their story to you unless they want to. Again, focus on what they need, what they need in that situation. Victim blaming, it's too many people out there doing it, and we have to stop pointing our fingers at survivors like they are the reasons that they are being abused when they're not.
I echo those sentiments, and also, even what have you tried is challenging, because it minimizes the current experience. And so my only question I ever ask anybody I serve, whether it's somebody who needs safe use supplies, somebody who needs safe sex supplies, somebody who's a victim of violence or otherwise, I say, what do you need? And that's all.
I think the only suggestion that I would add around best practices, and this is rooted in trauma-informed care, and that is to validate that survivor. Make sure that you are recognizing the strength it took to get where they are. If it's in the community and they're still in the situation, but they're reaching out to women, helping women to try and safety plan for the next step. If they've arrived in shelter, it is about expressing to this individual how courageous they are for getting to the point where they have made it alive with their children and their pets as necessary. But beyond that, I think searching for what they recognize, the survivor recognizes as their own strengths, and building upon that clinically is really critical. What we don't do is make an assumption that they're under the influence of drugs and therefore addicted to drugs. And oh, by the way, here's a pamphlet about the closest drug treatment facility. Can I make a call for you right now? And I'm being snarky intentionally. This is about the moment, because one wrong word and that survivor feeling like, oh, this is my fault. And trust me, that script is already there in their deep subconscious. Our number one goal is to do no further harm to them by providing a safe place, physically, emotionally, psychologically, to the best of our ability. That requires tremendous awareness.
Jamie, there is another question in the chat. What, in your opinion, is an appropriate safety plan guide?
Again, once you educate the survivor on what their options are, what their needs are, it is whatever they think is appropriate. Again, as long as they are safe, what they need, and they will let you know what they need. I like that when he said making those assumptions. Don't make an assumption about survivors, and always believe them. Believe their story when they tell you. I don't think there is a incorrect safety plan that you help the survivor come up with, because we're not coming up with it ourselves. This is for the survivor to you to help the survivor come up with the best options that they can come up with, or that we can help them with options, making sure they have options available, and then problem solving with them so that they can pick the right option for themselves.
I would agree. We also have a standardized form for safety planning, and it looks at what is the escape route, making sure you're getting copies of your documents, getting copies of your keys to your car, making sure that you have extra supplies, including medications for your children, for yourself. Is there a safe word that you can use with a trusted advisor that would alert them that you are in immediate danger so that you could make the call and have the police show up because you're worried your life is in jeopardy? Teaching age appropriately children to dial 911 and what to say, teaching them their address, having a mobile phone available and charged that's not traceable. These are all things that we talk about with survivors if they're still in the unsafe condition, but they're thinking about escaping. What we never say is, you need to do this tonight. Now that you have a plan, you need to go. This is about their timetable. And I think the last thing that I would say about this is that not all survivors want to leave permanently. And so there may be harm reduction even through consultation on the phone or after shelter. That means you go back to the person who was the perpetrator. But there are safety mechanisms in place with therapy and treatment and family support and wraparound services within the school to try and keep everyone safe. Because we all know how traumatizing it can be for children to be separated and torn apart by intimate partner violence, whether it's a same-sex couple or not. If it's a father, I think there was a question I saw, does YWCA take single men? Are those identifying as men into our shelter? Absolutely, we have, and we will in the future. So we do not discriminate. We do not discriminate. And safety is about what the survivor needs in the moment, but helping them think through the trauma, which is, fight, flight, freeze, block, all of those different divisions of trauma, and getting them prepared for the future.
Thank you, guys. That question was sort of like our next question. What are the correct steps for a person wanting to escape an IPV situation? So if none of you have anything to add on that subject, we can go ahead and move forward. And we
Maybe.
Yes.
There is a question in the chat that might be good to talk about now. When someone presents with drug use and trauma while in an abusive environment, what is your best practice approach?
When you say presents with drug use, I assume you mean that they are in active use with an illicit drug supply, not that somebody is misusing a prescription medication or managing their health care in their own way, a different way. I'll just assume that you mean the illicit drug supply. I would not approach them any differently other than without stigma, without implicit bias, and with radical, unconditional empathy and love. So that person knows that their experience is valid, that they are doing whatever they can to cope and survive, whether you view that as maladaptive or not. That is how they are getting their needs met. And we must meet our basic needs before we can make any long-term decisions.
Agree. In shelter, we talk about safe use. How do you access what it is that you're using in a way that doesn't place you at risk for further harm? And so we have very frank conversations about supply chains and paraphernalia that may be needed so that there isn't an additional dope sickness. Again, we're not trying to address the addiction in the moment. We are trying to keep this individual alive. And it is their choice to stop using. We want to make sure that everyone else is safe in shelter. So I don't want you to feel like this is wild, wild west with no parameters or boundaries here. We have children in shelter, so we're very clear about what that looks like. I would also say, though, that we have an incredibly fortunate situation with our brand new facility because we have 1-bedroom apartments. So families and individuals have their own space, their own cooking, their own bathrooms. So there's not a lot of common space that creates that risk factor for those who are in active addiction. So the substance of choice and what is needed to keep someone from not leaving our shelter, we're encouraging harm reduction in any way we possibly can within the shelter.
Thank you. Juan, did you have anything to add?
No, I ditto what they say. They're saying if they're not coming to me or coming to us for the drug addiction, and that's not what they want to focus on, that's not what we focus on. We focus on what their needs are, and I will always go back to what the survivor needs.
Awesome, thank you. Okay, our next question is, can you talk about intimate partner violence and mandated reporting? I would be interested to hear specifically if there are differences in mandated reporting when there's children involved versus when there's not children involved, things like that.
I'll take this one for a second. I own childcare. I own a daycare as well. And I specifically served families when I started my daycare of families of intimate partner violence, folks of LGBTQI plus community, and folks who had traumatic events in a child's life. Maybe you adopted someone who had gone through some sort of DV situation or otherwise. So I specifically was trying to do trauma-informed childcare. And mandated reporting isn't what you think it is. And it's very frustrating for me as somebody who is a mandated reporter to see how it is used to systematically oppress certain communities, to see how it is used from a stigma and implicit bias place, because what it seems like something that must be reported to you might not be that serious. And what's frustrating is CPS is overloaded. They have so many cases, so many things investigated that the true things kind of go through the cracks sometimes because they're investigating things that aren't actually things that need to be reported. I know they say if you see something, say something. Maybe talk it over with a colleague. Maybe really discuss if that's something that you need to elevate to that type of report. And then actually ask yourself, why am I reporting this? Am I fearful? Am I angry? Am I disgusted? Really ask yourself what feeling you're having that makes you want to make that report. Mandating reporting is pivotal, is important. If it didn't exist, there would be many lives lost. But we need to believe in our system and really understand what mandating reporting is. And I'll leave it at that.
With myself, I actually go out on domestic violence runs. Like when there's an incident and it's called out, they call us out. So I actually go out. I find that people are not willing to talk to you if they feel as though you're going to report them. So one thing that I do let them know that I am a mandated reporter. If you do tell me anything about children being harmed, that is something I do have to report. So I let them know off top. And so they kind of trust you more when you let them know, being you're genuine, and you let them know what can happen as a consequence to children being hurt in these situations. So I just come up. I'm honest. I'm truly honest with everybody. I'm genuine with them so that there is no surprises. But we are mandated reporters. But I usually go back and talk to my supervisor before I make any reports. I let them make that call because I don't want to make the mistake of doing anything that can do more harm to survivors. So yes, I do let them know that we are mandated reporters, but I also make sure I go talk it out with my supervisors so that I don't make any wrong mistakes.
We understand the law and the intent of the law and the goal to protect vulnerable children who might otherwise be horrifically harmed by abuse. With that said, I'm triggered by this because of generations of children stripped from native homes and placed in boarding schools because they wanted them to be assimilated and to avoid the trauma of neglect and abuse in these homes. So this hits close to home for me, full transparency. I'm a registered nurse. I'm a mandated reporter. What we talk about in our shelter, and unique to my sister colleagues here, is that we are thinking about what does it mean for this family? They are here in shelter at the moment in the safest place they've probably been in a long time. What can we do to walk alongside with a horrifically traumatized survivor, whatever the case, who may be emotionally exhausted and may not have the normal resources to cope with intense childcare. It happens. So how can we be a support in that moment? With that said, I want to be very clear. If there is imminent danger, of course we act. Of course we act. However, it is our goal to be supportive of this family. Because the last thing I want to make sure I'm being clear about is that in any relationship where there's intimate partner violence, and we see this with same gender couples as well as those that are not the co-threat or the counter threat or the retaliatory threat of my partner abused our children is real. That doesn't mean the actual incident is real. And so we want to make sure that we're being very clear with our survivors when they come in who is a mandated reporter and what our legal responsibilities are. But our primary goal is to keep them safe and to keep the children safe and connect them to resources and support to avoid further abuse and trauma. Last statement, just because someone is coming from an intimate partner violent situation or a domestic violence situation doesn't mean that the children have been abused, but we know that they've experienced trauma. Because even if they haven't been directly impacted by the perpetrator, they're experiencing the violence in the home. That doesn't mean that that's abuse simply because they were exposed to that. It may be triggering to a lot of you, but this is part of how we stop the cycle by getting families connected to the resources they need and building resilience in them and reporting them to Child Protective Services unless it's imminent danger only creates more harm for everyone involved.
I think that was beautifully put. And as I speak from my own living experience again, after my father's death and my mother's subsequent substance use disorder, where she was a very high functioning individual, kept her job. I was doing well in school. She was a victim of intimate partner violence as well. I grew up to be a victim of intimate partner violence because that was the behavior model to me about how a loving situation might look, correct? And what would have been the most devastating thing for me at that time is if somebody would have taken me from my mama. And it would have been the most devastating thing for her as well. And she wouldn't have survived even another couple of decades that she was able to through her substance use disorder had she been separated from me. And so you really do need to think about what intimate harm means, because sometimes that's what's got people holding on. I know you think that this kid is safe and they're alive now. Quality of life matters.
Thank you all so much. Those were great responses. I myself have never been in a situation where I have had to report something. I've certainly been in situations before where I have questioned whether I needed to report something. And I think that everyone probably has. And it's certainly important that people become aware of any implicit biases or cultural biases that they may have, because at the end of the day, you can end up making someone's life worse than it already was. So that's great information. We are running short on time, but I know there are a couple of questions in the Q&A box, but I have a question that I really wanted to get to. So I'll ask this one, and then maybe Midge, we can finish the ones in the Q&A. How do you as a professional keep yourself safe in situations where you are working with someone experiencing IPV?
I always tell folks that are worried about me doing outreach alone in certain neighborhoods because we have implicit bias and because data shows that maybe there's more crime in those areas. The crime happens to the people who live there, and so I'm more at risk of getting, a nail stuck in my tire because the city doesn't take care of that part of the community's roads than I am of something dangerous happening to me in these places. There is real risk to outreach workers, social workers, and other people who are dealing with populations that have increased risk. There truly is. But one of the ways to keep yourself safe is go with somebody else, make sure that you have a support system, case note, make sure people know where you're going to be, have set appointments, meet outside if you think it's an increased risk in a public public space. They're very common sense approaches to keeping yourself safe. But truly, you're not usually in danger of harm in my experience.
Let me say this the right way. Well, I'm from the neighborhoods where there's a lot of danger. It could be dangerous. I always say I'm from the hood. But I think the best way to keep yourself safe is to be aware of your surroundings. Always be aware of your surroundings. When we go out, we always are going out with officers. So the officer is always outside the home. We don't have the officer come and with us when we're talking to the survivor because their information is confidential. So I will ask the officer always, like, can you stand outside while I talk to the survivor? Just being aware of your surroundings, really, making sure that, you know, if you feel like it is unsafe, you may ask the officer to come into the house with you. Or if you do feel unsafe, you may not go into the house yourself. You sit outside and talk to the survivor. I've been on scenes where the purpose actually returned to the scene of the crime, whether it's just to get a cell phone or I was coming back to say I was sorry. Luckily, the police officer was there when they came back and they was able to arrest them. So with the, you know, with the divert that we're in, we're always with officers, and we also have radios, police radios, where we're able to push a button if, you know, we're in danger and things of that nature. But the officer is usually there. Now, when we go out to court, it's really, we meet the survivor at the location. So we go to court with them, civil protection order hearings, criminal proceedings. And a lot of times you already have security or, you know, officers at the court scenes. So it's not really any danger, you know. There's not really too much danger. Like Amanda said, a lot of people get hurt just being in the neighborhoods, you know, just being there. So it's not really too much danger, but I always say to be aware of your surroundings no matter where you're at.
I echo the awareness as the #1 defense mechanism for any danger. Just be aware and monitor your environment and make common sense decisions. With that said, we also know that the highest risk for severe harm and murder outside of Indigenous women are Black transgender women. And so Black transgender women who are coming into shelter here, we know have perhaps a higher degree of lethality. And so we're sensitive to that and making sure that we're planning appropriately as they move in and out of services where they're traveling to and from. It's an intentional process, understanding risk factors.
With the company itself, we just experienced somebody coming and looking for a survivor at the office. 2 men came in to look for a survivor. We didn't know who the survivor was, but they automatically evacuated the building. We all worked from home for the next 2 days, going to court from home. They made sure the elevators were locked so nobody can come up to the elevators, and we all took a separate route to get into our building for this week so that we can make sure that we all are safe in the building. So that's one way we do keep ourselves safe as advocates working in the building at the office.
Thank you all.
So we do have another question here for the panel. Does the YWCA allow single men to stay in the shelter? And then a second part of that question is, if not, how do you work with people in same-sex situations?
We absolutely allow single men in shelter and have had them before. And we have absolutely had some intimate partner violence between same-sex couples. And we are taking the survivor that presents to us, and we believe the survivor. We make no judgment about who has the power in any relationship. We believe the survivor who's calling us for support and help. I hope that answers the question.
Wendy, I have kind of a follow-up question to that. So in situations where I know I have had situations where I'm dealing with a person who is a survivor, and if it's a woman, they're afraid to be around any male figure, given what the trauma that they had been through. So what how does that work at the shelter when you have all genders staying?
We are sensitive to what can be a trigger to a survivor. But conversely, if you've got someone here who is a same-sex couple and her abuser is female, the majority of the women who are here are female. So I think it goes back to implicit bias and providing some education around what does safety look like in a shelter? What are our expectations around boundaries and mutual respect and dignity for everyone? And recognizing that abuse comes in all forms, regardless of who you are and how you identify and express your gender. And that seems to have worked with, for us. That doesn't mean that we don't deal with strong implicit bias from survivors in our shelter. We have to deal with that from time to time. And let's be clear, that's not limited to gender expression. It most often manifests as racial bias.
Thank you very much. We have about 2 minutes left. I have another question. If no one else has anything to put in the chat box, just had, what are some good resources for individuals who are experiencing intimate partner violence? Obviously, the three of you are great resources. But just anything else that comes to mind. I don't know if you want to say it or type it in the chat box so that individuals have those resources.
Sorry, is there a way to share these resources with attendees after the event? Because if so, I could send some links and things like that could be shared with the attendees.
I feel Midge, that's possible, right?
Yes, I believe it is.
Okay, yeah, I'll find out how you do that and I'll let you know, Mandolin. Thank you.
So there is a national hotline, intimate partner hotline database that everybody can call from all over the United States. But in Ohio or Cincinnati, you do have the Women Helping Women. You got the YWCA, and I think they also have a YWCA House of Peace. And then you also have the Legal Aid Society. A lot of people don't know that Legal Aid helps with the intimate partner survivors as well. They help you with filing civil protection orders. If you have any child dependency issues going on, such as custody, they help you with those, divorce. So a lot of people don't know that legal aid is also a good resource as well when it comes to intimate partner violence. But Women Helping Women, YWCA, legal aid, the national hotline. Then there's the Ohio Domestic Violence.
Yeah.
So yes, there's a few of them.
Thank you very much. I saw Trisha just put in the chat too that any resources that you all have that you think would be beneficial to our attendees, we can provide those in the PowerPoint and send them out to everyone. So if you all could email me with those, if you would like, that would be awesome. Thank you. And I believe we are out of time, but I just wanted to thank the three of you so much for being with us today. On behalf of Caracol, we really value and appreciate you all and taking the time out of your day to be with us and share your experience and wisdom. So thanks so much.